Good afternoon. Thanks for coming out today. What we saw last November was an election which was a statement that voters wanted to change the way things are done. And when you're looking at things that need to be changed, clearly one of those are the relationships that have existed between the state and federal government. We're very happy to welcome back one of our own, Congressman Matt Gaetz, to discuss some possibilities of areas where we can reduce the reach of the federal government and put more power back into the states to serve our people. We have some memorials that are working their way through the process. I'm going to introduce first Chair Caldwell to discuss the memorial working its way through his silo. He'll just give a brief overview. Then I'll introduce Chair Cummings to do the same. And then we're going to turn it over to Congressman Gaetz, where he can have a discussion and potentially field questions. And then the speaker will close us out. Thanks. Come on up, Chair Caldwell.
Thank you, Leader Rodriguez. And earlier this week, we did adopt a memorial asking Congress to set our people free, as it were, to let us get the transportation money that we need to build our projects without strings attached, without dictating to us how we spend it, without telling us that we have to pass laws that aren't related in any way whatsoever to the actual construction of transportation facilities. Give us the flexibility that we need. This is pretty straightforward, and it's a theme, obviously, that we're going to carry throughout the House, and I expect we're going to bring this to the floor and get it out and on to Congress ASAP.
Thank you and welcome everyone. At 3:30 today, Chair Magar will introduce a PCB, a House memorial related to the establishment of Medicaid block grants. I know that Speaker Corcoran and Congressman Gaetz, who you'll hear from both those gentlemen, have discussed this very important concept. Medicaid, as many of you know, has unfortunately captured over 30% of our state budget. It incentivizes increased expenditures, but also really stymies innovation and the ability to ensure quality outcomes. So it's something we're very excited about. You'll see more through the HHS committees and HHS, the large policy committee as well. So with that being said, Chair Gail Harrell with Children and Families Subcommittee has got a very important memorial as well that she wants to make a few comments about. Thank you.
Thank you very much for being here, and I want to welcome our colleague, wonderful colleague, Congressman Matt Gaetz, back to the Florida House. Welcome. And we are going to be presenting tomorrow in our committee, the Children and Families Committee, a memorial to Congress requesting that they give us a block grant in child welfare. Over the last 10 years, we have been the recipients of a waiver that has allowed us to use federal dollars that would have been totally and restricted to foster care out-of-home services. We've been given the flexibility under that waiver in order to use that $182 million that we receive in a much more advantageous way for children, going to the first part of the system and allowing us to keep more children in their homes, providing services in their homes to those parents, and making sure that we can keep children safe. It's giving us the flexibility that has allowed us to truly make major improvements in our child welfare system. We would request very graciously and respectfully that the federal government give us a block grant to continue to give those preventative services, in-home services, so we can keep families together and keep children safe. Thank you very much.
Hello, everyone. It's good to be back. I can share with you that after 6 years of service in the Florida Legislature and 6 weeks of service in the Congress, it has become exceedingly clear to me that Washington screws everything up. This is especially true in the area of health care. From a failing VA system that breaks promises to our veterans to the disaster that is Obamacare, the federal government has let the people of this country down. And the best thing we can do to facilitate more innovative solutions and better outcomes for Floridians and Americans all across the country is to devolve more authority and more resources to state governments. Today, I call on my colleagues in the Florida Legislature to pass the House memorial that will currently be up for consideration in the Healthcare Innovation Subcommittee, encouraging the federal government to engage in a block grant system of the Medicaid program. In many ways, Obamacare is a redesign of Medicaid. More than half of the people that Democrats claim are covered under Obamacare have been covered through Medicaid expansion. I believe the Florida House was right to reject Medicaid expansion under Speaker Corcoran's leadership, and we're being proven right each and every day as the states that expanded Medicaid are seeing more and more of a burden placed on truly vulnerable people as a consequence of too many that don't need to be in Medicaid being dumped into that system. So the best thing we can do for Floridians, for the country, for patients, and for providers is to disentangle Washington, D.C. from the provision of health care. Fortunately, our movement is gaining momentum. I can report to you that in every conversation we have within the Congressional Republican Conference, we talk with great enthusiasm about the possibility of giving states more flexibility and block grants to administer the Medicaid program. I believe that a majority of the Republicans in the Congress want to see this happen, and I am certain that the very competent people here in the state of Florida, in the legislature, in the governor's mansion, are capable of executing a Medicaid program that does a lot better for our constituents and those who are truly vulnerable and in need. In the coming weeks, I suspect that my colleagues and I in the Congress will be presenting very concrete plans to repeal and replace Obamacare. And I'm grateful to be here with so many leaders who are eager to step up to the plate and ensure that patients get what they need without all of the overutilization, waste, and abuse that we so frequently see. Particularly in the Florida House, we're lucky to have Speaker Corcoran as our leader. No Florida policymaker has been a stronger champion of states' rights, of flexibility, and of conservative principles than Richard Corcoran. And so he is just the person to help us design patient-centered health care, not administered by Washington, D.C., but truly administered by our states and our local government partners. I believe that we'll see progress quickly. I know there is a lot of anticipation about the elements of the Republican plan. My expectation is that we will see a combination of the 2015 repeal bill that President Obama vetoed, in addition to health savings accounts, the ability to buy insurance across state lines, state block grants, and other free market principles. And so now it is my great privilege to stand beside my dear friend, a committed conservative, and the leading voice for patient-centered health care in Florida, the Speaker of the House, Richard Corcoran.
I tried to hire him as my press secretary, but he turned me down for Congress. But I appreciate that warm intro, the excellent intro. Basically, we're excited. I mean, you just heard from a sitting congressman. There's a new day in Washington. There's an opportunity for us to, the things that we've been talking about when we were having these fights, where we could have a patient-centered system that would be more beneficial in healthcare. We could have a student-centered system in education that we could ultimately say, if we give us these funds and they're unrestricted and we can do great things in terms of the student-centered, we wouldn't have to worry about failure factories. You heard from Chairman Harrell and you heard from Chairman Caldwell. All these things, there's no question, there's no argument that the state government is better suited, better knowledgeable, more in tune with the people of their state, and more equipped to make those kind of decisions and those kinds of policy, create those kind of policy outcomes that benefit people. And so this is an exciting time, and we're looking forward to working with our partners in Congress. Matt's done a tremendous job of leading the way. We head up there, some of us next week, have additional meetings with Senator Rubio and other congressional leaders, trying to say to them, give us that opportunity and we'll succeed. And I think that it's forthcoming. And if any questions for any of us, feel free to ask.
Do you have any specifics? I mean, you said that there's people on Medicaid that don't need to be on Medicaid. Who are those people and where are those people going to go to get coverage?
Yeah, I would refer you to the floor debate that the Speaker and I had when Medicaid expansion was before the House of Representatives. And we made the argument and we cited the data that indicated that people on Medicaid aren't any healthier than the people who aren't on Medicaid. And you also see time and again Obamacare expansion impacting a population that are mostly able-bodied, childless adults. So right now we have an Obamacare system that is in a death spiral. And the only way to end that process of higher premiums and worse coverage is to preserve Medicaid as a safety net for those who are truly vulnerable without overburdening that system with folks who shouldn't be on Medicaid. But I yield to the Speaker to further expand on that.
Yeah, you got to keep in mind, we offered a tremendous degree of alternatives. So the crux of your question is, what are these people going to do? And the concept is, yes, tomorrow we have this patient-centered system that looks and has affordable outcomes for everybody at the same levels. Initially, that will be there, and it'll grow and grow and grow. So to your point, the legislation that we've been fighting for that would give them, that money comes down in a block grant. We create a voucher system where those people are in control of those dollars. And now you have a whole marketplace that builds it, just like Apple. Apple built a platform. That's all they did, is build a platform. And people said, you're going to build a platform, and then what are you going to do with all these people? Guess what? There's 1 million apps on Apple. If you build a platform in healthcare and allow these folks the opportunity to go out there and sell, because now these patient-centered people have real money in their pockets that they can absolutely go out and make choices and choose. Like you talked about, they could have a house savings account. That's a small cost compared to the full-on Medicaid requirements that we have to comply with the federal government. And what does that mean? If we had, and we get rid of the regulations around a lot of this stuff, you get rid of laws on the books that say that a ambulatory surgical center can't do surgeries. Nationwide, it's literally like $2 to $4 billion worth of savings. What happens to that money? That's back into the system that makes it more affordable for everybody. The entire thing that we've been talking about for 4 years is a system, and that free market system will give people more affordable, greater access, and better outcomes than any other system. It doesn't mean that we'll ever be able to move away, as the Congressman said, from a safety net. But what we have right now is not a safety net. What we have right now is a move towards 100% socialized medicine, and everyone will lose in that outcome.
Mr. Speaker, if you could help me, I'm a bit confused by what you just said. You just spoke of creating a voucher system with a block grant. Are you then suggesting that people would have complete choice and that you would remove all vestiges of managed care? Because we had a fee-for-service system that did give more flexibility to patients, but that was considered to be costly to me. So I'm curious if you're now advocating for eliminating the managed care system that we now have.
Well, first I'd say you ought not be confused, Gary, because it's been pretty consistent with what we've talked about for the last 4 years. So yes, we went from a fee-for-service model, and then we had a tectonic shift that went from a fee-for-service model, which was costing the state and had medical inflation rates in the double digits, sometimes approaching 15, 18, 20%. We went from that model to a managed care model. In the managed care model that we have, we've lowered the rate of growth, but there's still a tremendous rate of growth, and it's still continuing to eat away at our budget at record amounts. The next big phase, which we've talked about now for literally since we were freshmen in the House, the next big phase is, yes, the person who's best equipped to make a decision for what's best for them in their healthcare decisions or their child's healthcare decisions is the parent or the patient themselves. Give that patient that money and allow a free market to create itself around that and people to compete for those dollars. Yes, you would have greater access. We would be providing them with far greater access. Already we have tons of plans in the Obamacare are shutting down because they don't have network adequacy. That would not be an issue. Anybody, a dentist could put wares in the marketplace and say, I'll do all your dental care for $100 a year, just come to me. All of that will come in that marketplace. If we build it, they will come. That's happening everywhere else. When we did this in education, the same people, the same doubters, the same cynics said, you just can't give a voucher to a poor person who's ill-equipped to decide what's best for their child. We give them that voucher now. It's up to 100,000 people, and nobody can argue they're getting far better results in their educational outcomes than they were when we had a managed care government system. It's the same thing in healthcare, and that's what we've been pushing for from day one.
and everybody seems to be supportive of block grants. You said there are concerns that they have about how the money would be divided up among the states, and that the Medicaid programs are so different in different states, and that if it's done on a population basis, that's one thing. If it's done on a current amount of money going to states, that's another thing. Are you looking at those kinds of, I guess, sort of practical issues in terms of making sure that Florida doesn't get shorted if this type of system?
We are, and that is precisely the question that we're working on answering in the Congress in the coming weeks. There are some who believe that we ought to reward the states that bear hugged Obamacare and expanded Medicaid. I don't share that view. Congressman Webster has made a very compelling argument that Florida has a disproportionate amount of nursing home care that we provide through our Medicaid program, and that must be accounted for in some way. And so working through those algorithms and formulas will be the necessary and critical intellectual labor that the Congress will have to perform. I have been one of the strongest voices in the Republican conference to not micromanage our mechanisms of devolving funding to the states. I just do not believe that in Washington, D.C., we've got the human capital to be able to solve all problems for all people in all states. I support a per capita formula that would block grant Medicaid resources based on population and pre-expansion utilization of Medicaid. And here's one example of why that's so important. About 1 out of every 4 Americans is on Medicaid today. Last time I checked, about 1 out of every 6 Floridians was on Medicaid. But then if you look at states like California that expanded, you've got more than 1 out of every 3 Californians on Medicaid. And it's not just blue states. 1 out of every 3 people in Arkansas is on Medicaid. 30% of the state of Kentucky is on Medicaid. And so to get 218 votes in the House of Representatives and 51 votes in the Senate, we will have to all give a little to ultimately achieve a block grant solution. But we should not view success or failure based on whether or not the state of Florida gets more money. The Speaker and I are of one mind that we could do a whole lot more with less money if we had total control in the state of Florida. If we could manage utilization with reasonable copays, with work requirements for able-bodied childless adults, I think we would be able to control cost. And the mistake the Democrats make is that they believe healthcare is just about coverage. But what they're learning through the failure of Obamacare expansion is that healthcare coverage that does not lead to actual healthcare is illusory. When I talk to my colleagues in Arkansas and in California, they tell tragic stories of their constituents who have a card that tells them they have healthcare, but there's no doctor that's willing to see them. There's no specialist that they can get into for months. We believe in Medicaid as a safety net for the vulnerable, and we do no service to the vulnerable when we overpopulate Medicaid with people who really should be in charge of their own health care decisions with a state-managed, patient-centered health care system.
Thank you.
How would that plan address pre-existing conditions?
Yeah, I mentioned earlier in my remarks that the beginning of the discussion that we've had in the Republican conference in the Congress is the 2015 repeal bill that President Obama vetoed. That legislation preserved coverage for those with pre-existing conditions and allowed folks to be able to keep their adult children on their plans up until age 26. So there is universal agreement on those two subjects. The question is whether or not Washington ought to design yet another one-size-fits-all entitlement program that we call something other than Obamacare, or whether we should devolve the authority to design the provision of health care to our states. And I'm under no illusion that every state will get it right. I know Florida will, because I know that Speaker Corcoran and Governor Scott and free market thinkers in the Senate like Senator Brandis and Senator Hudson and Senator Bradley, who I met with earlier today, will ensure that we cover the right folks and that we do it in a responsible way that controls cost. I simply don't trust Washington, D.C. to dictate those terms to us and then expect us to be able to achieve the maximum amounts of efficiency.
If you guys, we'll finish here because a lot of these resolutions are up starting at 3:30. The transportation one, the healthcare ones are up. So if you want to follow up after, you're welcome to. Thank you.
Great, thanks.
Okay, so, I mean, there were contradictory answers